Well, thank you, Madam Speaker. And I'm here today to specifically talk about public health care and the fact that in this country we're seeing public health care really be undermined and falling apart in profound ways. And I'm seeing it in my riding fall apart in ways that I could never have imagined just a few years ago. Before I talk about the specific issue, I just want to take this opportunity to thank the healthcare workers, all of those professionals, all of those doctors, nurses, all the support staff around them that supported us through the pandemic. And we know, and we've heard all of the stats, that we're seeing a high level of burnout. A lot of folks that were planning to work for many more years are retiring early because of the stress and because of those real concerns. So I want to thank them and honor their work. But we also know that healthcare across Canada is in a crisis point. For months in my riding, emergency rooms have been closing in Port Hardy, Port McNeill, and Alert Bay. Madam Speaker, for those of the Canadians that don't know, Alert Bay is a ferry community where they are placed on Malcolm Island, and healthcare, of course, from their hospital is key because they can't just drive somewhere quickly. So that's a major concern. We know that there have been multiple weeks of having some of these hospitals shut down, their emergency rooms shut down all night long. And I can't imagine for my constituents how terrifying it is to know that they don't have an emergency room around the corner if they desperately need it in the middle of the night. In fact, Madam Speaker, in October, Port Hardy's emergency room was closed for 28 nights of the month. 28 nights with no emergency room facilities. The reason is a lack of staffing, not enough doctors, not enough nurses, not enough people to provide those essential services. So we are watching in this country our national public health care system falling apart at the seams. And I'm here to plead for my constituents to come before this place and ask the federal government to step up and start doing their part. Whenever I think of public health care, universal public health care, I think of Tommy Douglas, voted the greatest Canadian because of his fundamental work in the public health care and making sure that that was a reality in Canada. We have heard the stories before this system was in place of people losing absolutely everything because they had to pay for health care to try to save the lives of loved ones. He said, "I came to believe that healthcare services ought not to have a price tag on them and that people should be able to get whatever healthcare services they require, irrespective of their individual capacity to pay." So we know that Canadians believe in public health care. We know that any form of privatization promises only a return to everyday Canadians rely on their individual capacity to pay for health care. And I hope that this government is going to stand against that. And I'm tired of hearing that this is a provincial or territorial responsibility. This is a joint one where we're seeing very clearly from the premiers across every province and every territory stand up. They are doing an ad campaign collectively, calling on this government to step up and pay their part. That is something that is tremendously important, because how often do all of those premiers agree so specifically on something? Rural and remote communities across this country have been left behind, and the federal government needs to step up and make sure that there's a meaningful strategy for healthcare for communities like mine who are desperately waiting.
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker, and I genuinely want to thank my friend and colleague for the question, for engaging, and for her sincere concern for the healthcare crisis in Canada. And I too wish to thank healthcare workers in my community of Milton, in my province of Ontario, and across Canada. The burden that they've shouldered over the last couple of years has been immense, immeasurable, and unfair. And that burden continues today. The pandemic's not over, and the backlog ensues. People are counting on us as legislators to find solutions to problems. And today in the Health Committee, we put the final touches on our committee report on the human resources in healthcare crisis. And I'm looking forward to it being tabled in this House of Commons because I think it creates some really, really good recommendations for our government as well as the Minister of Health, who I'm very privileged to work with. Obviously, the Minister appeared a number of times, as did officials, doctors, nurses, representatives of the healthcare system across the country, and it's a good report. I'm proud of the work, I'm proud of the recommendations, and I'm looking forward to seeing the outcomes from the meeting that's upcoming with the Minister of Health and all of the Ministers of Health from all of the premiers across the country. But the question today is about the human resource healthcare crisis, I believe, and the current shortage of health workers has led to reduced hospital capacity, as we've seen, and in some cases the complete closure of emergency rooms, which can't happen in a Canadian town or city. And that's enhanced, as my honourable colleague pointed out, in rural areas. We know that people who live in rural and remote areas already have a harder time accessing health care, and now they're being hardest hit by health worker shortages. Long-standing systemic challenges, which are exacerbated by the pandemic, those have resulted in health workers managing high patient workloads, resource scarcity, fear for personal safety, and unprecedented levels of burnout, absences, and turnover. We have a healthcare crisis because we have a health workers crisis. From the beginning, our government has worked hard and hand in hand with provinces and territories in the fight against COVID-19. We provided them with an extra $72 billion to support health systems and protect Canadians. That included a $2 billion top-up just recently to the Canada Health Transfer to improve healthcare in Canada, including by reducing backlogs by COVID-19 and growing our health workforce. This will help to support the health and well-being of Canadians and those on the front lines of our healthcare system. To support the mental health and well-being of our health force, Budget 2022 also provided $140 million over 2 years to the Wellness Together Canada portal, which offers free confidential mental health and substance use tools and services for frontline healthcare workers. Now, Madam Speaker, as I mentioned, I live in Ontario, and the Premier of Ontario has been, talking about the need to fund incrementally healthcare in Canada. We've been there. We've been there very, very consistently throughout the pandemic and before. They're using some numbers that I don't think are necessarily true with respect to the percentage that the federal government currently contributes to healthcare. I do think that the Canada Health Transfer, the federal portion, needs to go up. However, I think it would be irresponsible for us as a federal government, as the federal government in Canada, to provide that transfer without listing some priorities and ensuring that there are some targeted measures that those provincial and territorial governments will ensure occur. I think Canadians deserve to know that these healthcare dollars are being spent responsibly. And as an Ontarian, when I receive hundreds of dollars in a rebate to my license plate stickers right before a provincial election, that's right after that incremental $2 billion went out to provinces and territories, I'm concerned that provinces and territories who are balancing their books, having budget surpluses, aren't spending that money properly.
The honourable member for North Island Powell River.
Well, Madam Speaker, it's very clear. What all the premiers across this country are asking for is an increase to the healthcare transfer. We can talk about the ties that should be put on there in terms of criteria, but we know that these hospitals, their emergency rooms have been closed 28 days, weeks of nights, where if anything happens, these people can't access an emergency room. Rural and remote communities deserve better. We can talk about Quadra Island, another ferry-dependent island in my community. No local paramedics for 11 days. In Powell River, hospital labs for outpatients closed all weekend, sending people away to get the services they desperately need, and wait times are only increasing. This has huge economic impacts on rural and remote communities as well. How do they attract people when they know that there isn't an emergency room? This government needs to listen to Canadians, listen to the premiers, and start putting more money into those healthcare transfers now.
The Honourable Parliamentary Secretary.
Thank you, Madam Speaker. And I agree that we've got to increase the Canada Health Transfer. It's just not a matter of saying, here's unlimited money to spend on whatever you'd like, including budget surpluses and $500 checks to millionaires, as they do in your province, Madam Speaker, of Quebec. I think we need to spend that money responsibly and make sure that it actually solves the problems that my honourable colleague so eloquently pointed at this evening. So I think we all agree that Canada Health Transfer will go up. But let's have a little look at the last couple of years and all of the incremental funding that we've provided. An investment of $115 million over 5 years with $30 million ongoing to expand the foreign credential recognition program to help 11,000 internationally trained healthcare professionals per year get their credentials recognized and find work in their field. The list goes on, Madam Speaker. Our investments in the healthcare sector are vast, and they will continue to grow as the needs of Canadians continue to go up. We've got to tackle this, and it's all about